Hi, and welcome to Rise, Heal, and Grow. I'm Leah M. Hill. This show is a podcast production of Apollo Sunrise Center, which is a holistic wellness retreat center in Newburyport, Massachusetts. On this show, we shine the light on those who nurture wellness and inspire positive change. My guest today is Jennifer Gilligan of Cove Aesthetics and Care. Hi, Jennifer.
Hi.
Thank you for being here today.
Thank you so much for having me.
Well, when I met you not too long ago, when we were at a women's networking event and you were the featured speaker that night, I was just so impressed by how much information you shared, expertise, and not only that, I felt information that I wasn't getting anywhere else as a woman, as a midlife woman, or anything, you know, just anything regarding like health and wellness, that you had so much information to share. So I do want to talk to you about that, but I do feel that, you know, you have a lot of expertise, you have a lot of experience, you have a successful business, and people see you as this high-achieving, successful woman. But was it always like that for you?
No.
No?
You
evolved.
I was evolving. It took me a while to get here, I'll tell you.
Yeah?
Well, it started out, you know, I was a little worker bee nurse in the hospitals and for home care, and just kind of toeing the line, doing what I'm supposed to do.
Yeah.
And it was kind of killing me, you know.
Oh,
and it was
just the grind.
It was the grind.
Yeah.
And it felt as if I was helping my patients less and less and helping corporate medicine more and more.
Yeah.
And
well, that was sad.
It was sad.
It kind of bears down on you.
It does
after
bear
a
down
while.
on you. And God forbid you revolt, because then you get a target on your back.
Oh,
you know?
right. So you were a hospital nurse.
Worked in hospitals.
Oh, okay.
I worked, then when I started having my kids and, you know, settling in, I was in home care, and I was a case manager.
Okay.
And I loved that. It was really nice. It was going to the patient's home and really finding out who they are, what makes them tick. And it gave you opportunity to specialize their medicine and kind of come at them from where they're familiar to help change.
Right.
But unfortunately, it became less and less possible to do that as the years went on.
Even that.
Yeah, even that. It was in and out in 10, 15 minutes and on to the next person, and admitting more patients to the service.
Yeah. That's hard to keep up with that and keep that positive energy and wanting, because it seems like you're a natural caregiver. Like that's who you are, and then it's hard when you can't really do that.
Right. It is.
You
It
know?
became harder and harder to do that.
Yeah. So then you evolved and you went to Kripalu for a while, Kripalu Center?
Yeah, I did that in my teens.
In your teens? Wow.
No, I'm sorry, late teens, early 20s.
Okay.
I spent some time at Kripalu. I used to go on those welcome weekends.
Yes.
Were you familiar with it back then?
Yeah. Well, I don't know how I'm
In
not
the
sure. I've been
Berkshires.
there a few times, but I love that. You know, it's just it's a beautiful
It's
location
amazing there.
and gorgeous.
Yeah.
And,
I got married out in the Berkshires too.
Oh, I
it was
love the
great.
Berkshires.
Yeah. It was funny. I'd go out there for these welcome weekends, and I remember they were $175 for the weekend.
Oh gosh,
And included like all these programs and meditations and all your food. It was
that's amazing.
I can't imagine what it costs now.
Right.
Yeah.
So you've always spent, you know, your career in caring for others, really, is what it sounds like. So then you evolved from the nursing practice. Was it to your own business?
Years later.
Okay.
I mean, years of working in hospitals, years of doing case management. And my husband's job brought us abroad for a few years, so we did that as well. And we'd come home summers, and I'd work case managing for the summer. It was fun.
Yeah.
I loved working.
Yeah.
You know? So.
Well, that's hard work too.
Yeah.
I mean, what you were doing, that's a lot.
It was a lot, but it was fun. I liked it. I don't like to sit still.
Right.
So I started the business under a medical director. I'll never forget it. I ran into a friend from high school who was a therapist at Crosby's in Manchester when I was doing home care. Yeah, did I tell you the story?
No, but I know the store.
The store. I think you said story. She was fed up with billing Medicare, and she was griping, and I was griping about just, and I said, I swear to God, I'm just going to go learn how to do Botox and inject Botox to people the rest of my life. And she goes, my sister-in-law does that. There's a doctor who teaches it in Boston. So I'm like, huh. She's like, here's her number, call her. She's on bed rest. She's about to have twins. I was like,
Oh my gosh.
so I called her, and she gave me all the information. She's like, definitely go do that. And so I called up this doctor, and he's, oh yeah, I'm having a class in January. And this was like, I don't know, November.
Yeah.
And I went to the class, and I was like, I think I'm about to change my life. And
Wow.
and I started doing it out of my house. And then you couldn't do that anymore. So I rented a space, and then a bigger space, and now a bigger space, and to where I am now.
It's just grown and evolved so much.
Yeah.
And you do a lot more than just Botox now.
Oh,
in your
yeah,
business.
yeah,
Yes,
that's right.
yes,
That
but
was
that's
as
how
an-
it started.
Yeah, that's how it started. And then got my NP, and right as I was in school, Governor Baker passed that law that nurse practitioners could practice medicine independently in Massachusetts.
Yeah.
Yes, it was
Yeah.
like perfect.
I imagine.
Right during COVID. And so when I graduated, you still have to collaborate with a medical
Sure.
person for 2 years, but you just run it the way you want and practice the medicine you want to practice. I don't take insurance, so I keep my costs down though.
Yeah.
I keep it.
And you make it accessible.
I make it
for
accessible and
people. Right.
affordable for people to come and just fill the holes where the primary cares don't have time to fill.
Yeah, so let's talk about that.
Yeah.
With what you talk about our, I think you call it our sick care system,
Yes.
rather than a health care system
Yes.
that we have now. So what does that mean to you?
Oh boy, to me it's one size fits all medicine.
Yeah.
We have insurance companies dictating what's to be done for a certain complaint,
Right.
and pharmaceutical companies feeding into the system and making a profit. And we were talking about this at the women's meeting that we were at together. Woman goes in, I'm exhausted, I don't feel like myself, something's off. Well, here, have an SSRI. Let's put you on some Prozac or
Something
Effexor
for
or
depression.
something
or
for depression,
emotional.
a
Oh, okay.
pharmaceutical, where it could be your hormones are out of alignment. You need them
Yeah.
optimized. You need from the root, from what's going on in your core, what's going on with your thyroid.
Yeah.
Let's look at that first. It takes time.
Right.
It takes thought. It takes effort.
It's not something you can get an answer to in a 15-minute,
Nope.
protocol
You can't.
appointment at your doctor's office, right?
Exactly.
Yeah, because that's what I found so interesting when I heard your talk was that you were sharing so much information about hormones and how they affect us as women, especially throughout our lives, but especially midlife too.
Yeah.
And there was. You were like listing these ways that our hormones affect us that I never knew about. I never heard of. Like you're saying, things like it could be emotional. It could affect us in so many different ways. We just think of it as, gaining weight or, body changes, those kinds of things. But there's so many more.
There is so much more. I
Yeah.
could elaborate, but we could sit here for another hour.
I know. That would be a long
Real
show.
quick, we've got, women's estrogen as it begins to decline and our progesterone becomes unstable and our testosterone. That's where we have our bone loss. That's where we're at risk for more cardiovascular disease. This is where we're at risk for dementia when we get old. It's not just, there are things you can feel when your hormones are optimized, your mood is better, your libido is better,
Okay.
but there's more going on behind the scenes.
Right. So your job, if I can say, is to kind of find the root cause.
Find the root cause.
Find the root cause.
Yeah.
So an experience, if I was came to you as a patient and said, look, I've put on weight, that's not coming off. I don't know if I'm really feeling like myself. I'm wanting to eat all the time. Anything, all kinds of different random things that I might not even realize have anything to do with my hormones.
Yeah.
And what would you do? Is there like a battery of tests that you
I'd
put
sit
the person
and
through?
listen to you.
Oh, you listen.
I'll sit and listen.
That's the first thing. That's the first thing. That's the difference right there.
Yeah, write
To
down your
sit and
complaints.
listen. Okay.
Get a good history.
Yep.
Find out what's worked for you in the past.
Yeah.
If anything's working for you now, and try to build from there. And then get that blood panel that has these little interesting tests that insurances don't cover and don't recommend.
Oh, okay.
Okay.
So these are tests that you can get from a blood sample that might not even, be included or
Yeah,
something that
right.
the doctor would prescribe to get
Well,
ordered.
for
Okay.
example, a regular doctor is going to order what's going on with your thyroid.
Yeah,
Well, they'll get a TSH, a thyroid stimulating hormone.
right.
But there's T3, T4, free T3, like those numbers are significant and they're not getting looked at.
Oh, we don't even know about that. Yeah.
Yeah.
Yeah, we
There's
don't
that.
we don't talk about that.
Yep, sex hormone binding globulin, like how much is hanging around and what is your body using of the
Right.
testosterone and the estrogen that may still be floating around in your bloodstream or that still being produced by.
Okay.
Yeah.
Interesting. And you can tell this from a blood test. That's amazing.
Several, yeah.
Yeah.
Yeah, it's
Wow.
possible.
That
It's
is
really-
that is great. So I can
Yeah.
imagine just having that much data and that much information is so important for people that feel like they've gone to the different doctors and then the specialist, because that's the other thing. You go to
Oh,
the doctor
yeah.
and you get sent to the specialist and then
Yeah.
another specialist.
Oh.
And it's like,
Yeah.
just to have this in-depth information in one place
Yeah.
is
Yeah.
huge.
Yeah, it's huge. I mean, there's still need for specialists and, I can't.
Absolutely, yeah.
I can't fix everything, but I'm
Yeah.
going to try like heck,
Yeah. So why is it so important to treat the whole person like you talk about instead of just these symptoms that the person might be talking about, the depression or the low libido or
Because when
something?
you're treating the whole person, you're getting to the root cause.
That's how you
When
get
you're-
to the root cause.
When
Okay.
when you're treating the symptoms, you're throwing a pharmaceutical or a Band-Aid on it,
Yeah.
Pharmaceuticals have their place. I don't want to come off that I'm, anti-vax or any of this, because all
Right.
those things are important and useful, and they have their place.
Well, sure.
And they're very important, but.
Yeah. So can you give some examples maybe of, a story or an example that you can share of someone that came to you and was maybe discovered something that they wouldn't have normally
Yeah.
found otherwise?
Yeah, sure. I have a patient who, diagnosed with breast cancer.
Okay.
We were going to do, we did her blood panel. We were going to implant some hormones in her with little pellets that I sometimes use.
Okay.
And I said, have you had your mammogram? She said no. So she had her mammogram. We were holding off till that came back, and lo and behold, they found something. And so she's a friend of mine as well. And she's tiny, and she's frail, and she's small,
Yeah.
and she's little, and scared to death.
Oh, sure.
And
Yeah.
not a medical person.
Sure. Yeah.
Went with her, and they're just kind of talking about what they're going to do and the protocol and rushing her through, and it's fine. I mean, tons of people with breast cancer, but
Right.
I said, well, look how small she is, and you're going to start ripping away all her estrogen and progesterone and suppressing that. So where is her baseline DAXA screening, which is your osteoporosis screening? They hadn't done one yet.
Oh.
And she's been in menopause for about 6 years. Well, we're not going to get them. I'm like, well, why not? And nobody had a good answer.
Oh, gosh.
Basically, it was because the insurance wouldn't pay for it.
Oh, that's why.
So one of the things, this is what drives me crazy about the healthcare system,
Yeah.
because she had osteopenia.
Oh, gosh.
It's like, so what are we going to do? How are we going to manage that when you're suppressing all her hormones and hitting her with radiation and everything else that makes it worse?
Yeah, sure.
Where's the
And
plan?
especially in someone who is frail already
Tiny.
tiny to begin
Yeah.
with.
Yeah.
Sure.
Who's at high risk?
Yeah.
No plan for that.
Oh, gosh.
Yeah.
So what you're saying is that the medical facility that she went to, the doctors that she went to, just didn't take any of that, her size and
No.
how it affects her body, into consideration. It was basically, this is the protocol,
Yeah.
this is the diagnosis, this
Yeah.
is the protocol, and it's the same for everybody.
Yeah.
Yeah.
Tunnel vision to the cancer.
Yeah.
And that's all well and good.
Right.
But everything's going on globally.
So many
There's
things,
so
yeah.
many facets to cancer, and
Right.
yeah, which many people know. Anyone who's gone through it,
Yeah.
you don't just go and get treated and then you're fine.
Right.
There's damage done from the treatment.
Yeah.
Yeah.
So even talking about some of the symptoms that we experience, are there any that, we shouldn't ignore, like any really red flag symptoms that we should actually, you
There's
know.
lots of red flag
Oh, there's
symptoms.
probably a lot. Yeah.
Yeah, but you know, I mean, women come to me with the, I don't feel like myself. Men
Okay.
come to me, I don't feel like myself.
Okay. So you can feel it in your body. That's
You
what I
just,
feel
you
like.
just,
that-
yeah, you just
Yeah.
feel not right. Something isn't right, you know. And when you balance out, not for everybody, but many, many people, when you optimize their hormone levels and their thyroid, and thyroid's a hormone, you know, it's a gland that produces hormone. When you get all that lined up and optimized, people feel a lot better.
Right.
You know?
Right. I totally get that. I mean, times in my life when there was, like, when I found out later there was something going on, but it was like, yeah, that's what I felt like. Something is off. I'm just not myself. I don't have, I usually was energy too. I usually didn't have my usual energy.
Yes.
I was feeling like I had to, you know, take a nap every day or something. I was just like really exhausted that didn't have any other explanation. So,
Right.
but it's like, I think, you know, there are ways that your body's telling you something's
Yeah.
going on.
Yep.
It's time to pay attention.
Yeah.
So I think that's why it's so important that you teach people to self-advocate.
Yes,
is
that
what
I
you
wish
do.
I could start a business doing that. Maybe I will.
Maybe you should.
Yeah, because people,
Yeah.
educated people, and this isn't a diss on anybody, but I've taken care of, you know, Harvard grads and incredibly, incredibly smart people who are smart, but medicine's not their wheelhouse, and
Yeah.
you can't expect everybody to know everything. I mean, I don't know anything about finance or, you know, a lot about oncology, but I know my little wheelhouse, and I do the best I can with that. But people aren't getting educated in their health care, and that's
Sure.
important for everyone to know, because it's your body, and you're
Yeah.
coming from this vehicle, and you want to keep it running well.
Right, and I think so many people would be hesitant to self-advocate because they feel like they don't know enough. You know,
Right.
like, I don't even know what I should be asking, so how can
Right.
I advocate for myself?
Right, like my friend who
Yeah.
was
How would she know to even ask that?
she
Right.
didn't even think about it. You
Yeah.
know? But it's important. God forbid she breaks a hip in 20 years. She's not going to be. That'll be ugly. That would be
Yeah,
bad. You know?
absolutely. Yeah.
Um,
So I like that you teach people to just, I mean, you can't teach them everything, right? You can't teach them every possibility,
Yeah.
but just to kind of know or get used to what are the questions to ask and what are the things maybe to do some research on.
Right.
You know.
What is you're asking me what to do research on? What do you,
Yeah, well, like that, or that you would advise,
people to
advise
ask.
people to
I
ask
can
these
tell you what not
questions.
to ask, and don't
Oh,
walk
yeah.
into a doctor's office and say, "I've done my research."
Oh,
Nobody
you're not
likes
supposed
that.
to say. Nobody likes that.
Doctors
That's the way to turn
doctors
it
don't
off.
like that. Yeah.
Okay.
It's, you know, if it, you know, and research to a lot of doctors is Google Doc and WebMD, which they don't, you know.
Oh, so they don't want that.
Nobody
Okay.
wants to hear that.
Right, right.
Nobody.
But if someone were to maybe, talk to their doctor and feel like they're being dismissed or they're
Yeah.
not being heard, is there something that they should say that wouldn't necessarily, do you have any advice?
I do. Look them straight in the eye and go, I know something isn't right here. How are we going to figure this out?
I know something isn't right
Yeah.
here. Okay.
Something isn't
How
right.
are we going to figure this out?
Yeah.
We, like us.
Yeah.
I like that.
Yeah.
I like that because it's not off-putting.
No.
It's very clear and firm, and it's like you're not saying you're not listening to me or you're dismissing
Yeah.
me. You're saying this is my truth.
This is my truth. How are we going to sort this out? Because
Yeah.
something isn't right.
I think that's really good advice.
Yeah, thank you.
I like that.
Yeah,
a lot.
I mean, I've been dismissed even recently. I had my own little health journey where
Really?
they wanted to pull out my parathyroids based on 2 elevated calcium tests that I had. And I was probably a little dehydrated because I'm not the best water drinker. And I knew that. Another thing, it's like, here I am, a nurse practitioner. I understood that I was probably a little dry when they drew my blood, and my calcium was
Oh.
elevated just a bit.
And that
Sent me
would've
to
done
a
it.
surgeon to yank out my parathyroid. And I'm like, what? I actually went to the doctor, and I was like, why are we doing this?
Yeah.
And after I did my own research and
Okay.
figuring this out, I was like, and then I said, let's try it again. And it was back to normal.
You're kidding.
No.
And it was back to normal.
I had been to a surgeon. I didn't
Wow.
schedule surgery because, again, my gut didn't feel right.
Yeah.
I'm like, well, How do you know if my parathyroid, I mean, every other blood test related to thyroid, parathyroid, everything came back normal except that calcium.
Except for that one.
That one little thing that was slightly
Oh,
elevated.
Got it.
Yeah.
Yeah.
Is that not crazy?
And they were ready to do surgery
They were ready
and
to
remove
cut
it.
my neck open and dig around there and find
Yeah.
things that look like he said lentils.
Yes.
To take them out. I was like, okay. Yeah.
Right. Wow. Well, that's amazing.
It's unbelievable.
that even with you, but you were able to advocate and say, you know, I'm going to take a little look into this, you know, and you're not dismissing it right away.
No.
You're not saying, no, you're wrong or anything, but you're
No.
saying, you know what, I'm going to step back,
Yeah.
take a look at this and try
found out that
try something else.
it wasn't what it was fine.
Yeah,
Yeah.
that's amazing. Because you've also said that there's always another way to heal.
There is always another way to heal,
What
and that's a
is-
perfect example.
That's a perfect example of
Yeah,
it.
yeah.
So to think about it, we do tend to think that there's only one way to heal, and because of what the insurance will pay, that's
Right.
the route that we go down.
Yeah.
And it does cost a lot to advocate for yourself, right? It could.
It
Take
could.
responsibility for your own health. It could still cost a lot, but it also costs a lot for all the things that insurance doesn't cover, right?
Exactly.
You know,
Yeah.
that you still need a lot of the medications and everything that aren't covered or aren't
Yeah.
covered fully. That costs a lot too.
It really does, but it costs you a lot, and it's lining the pockets of other people when
Yeah.
they're selling tons of medications that they may not need to be on.
Yeah.
Part of my job when I was a case manager with the elderly and over 55 crowd, de-prescribing. They were on so many medications that were making them sicker.
Oh my gosh.
Yeah.
Yeah, you never come off some of those medications, right? They just figure you're at an age or a certain age
Yeah.
and you're just on them the rest of your life.
Right.
Wow.
The cardiologist isn't talking to the renal doctor or the kidney doctor or the endocrinologist that's managing the diabetes, and they're on all these medications and
Yeah.
lots of interactions and lots of unwanted side effects and
Yeah.
a lot of doing more harm than good. And many people were de-prescribed 3 or 4 medications that they did not really
Yeah.
necessarily
That's
need to be
amazing
on.
because you really, you don't hear about that
No.
at all. That's very interesting
Mm-hmm.
that you had that perspective, you know, because of your own experience
Yeah.
with 30 years or so in the field of
Yeah.
working and seeing it happen,
Yeah.
and not just you know, brushing it under the rug.
Right? Yeah.
Being, you know, taking some responsibility and saying, you know, this doesn't look right.
Yeah.
Yeah.
It was, I had one patient I'll never forget years ago. He had about 5 doctors involved in his care, and he had drawers and drawers full of medications and lists that made no sense to me. And I remember I went on my day off on a Friday and spent 3 hours at his house
Wow.
calling 5 doctors
Wow.
back and forth, like 3-4 hours out of
Yeah,
his
just
house.
to advocate for this person.
Yeah.
That's amazing.
Yeah,
Yeah, no,
for this
not a lot of
one
people
patient.
would do that.
I know.
Yeah.
Well, luckily I put in for the hours and got paid.
Yeah, but
it was a
still.
mess, and it's
Yeah.
like, how did you end up here?
Right.
You know, he was a sweet, sweet patient, but obviously didn't advocate for himself, didn't ask questions.
Yeah.
Of that generation, the doctor knows best. And
Absolutely. Yeah, I'm familiar
Yeah.
with that. Yes,
Yeah.
definitely.
Yeah.
And how do emotions play into this? Because I believe that our emotions, especially something over a long period of time, affects us physically. Do you believe that as well?
100%.
Yeah.
100%. I could walk into patients' rooms or into their house and tell you how good or bad their outcomes would be based on their attitude and their
Really?
Uh-huh.
Like the
I hate to say it. It sounds very judgy, but
Oh, well, you're
Well, I'm
talking
go-
from experience. You're
this
not, you know.
this person I'm going to help.
Yeah.
This person's going to get better. This person, I can talk till I'm blue in the face.
They're not gonna
bang
listen.
my head on the
Yeah.
wall, and they are going to listen to their narrative of what they're.
Yeah.
I'm an unwell person. This is my cross to bear. Yeah, that kind of.
Yeah. Well, then there's
We've all
nothing
met
anybody
people.
can do. Yeah.
Right. We've all met people like that.
Yeah.
That just being unwell is their story. It's their persona. It's just how it's going to be. You know.
Yeah.
And that being said, there are people that are super, super sick, and it doesn't dawn on them that they're sick, and they're out having a good time, you know? And
Right.
and their quality of life is better with
Yeah.
more sickness and more diagnosis than somebody who doesn't have as bad a diagnosis, who
Right.
makes it, I know.
Like it's
Yeah.
like it's the end of the road or
Yeah,
something, and the
yeah.
difference between like, no, okay, I'm just going to get this out of the way because I still have a lot of
Exact-
living to do.
Right,
There's
exactly.
still a
It's
lot
such
I
a
wanna do.
mindset, and it's
Yeah.
emotional, and it's spiritual, and it's mental, and
Right.
it's been so many
Wow.
years of seeing that. You know?
Yeah. And what do you do for yourself? Like, do you have practices that help you stay grounded with all of, I mean, you're managing a lot, not only, like you said, your own things, but with all these patients and people that you know
Yeah.
and everything. That's a lot.
Today is one of those days.
Yeah. It was kind of all hitting you.
Yeah, it was all coming at me at once.
Oh,
so
no.
yeah, what do? I like to drive around in my car and sing. But nobody can hear me,
yes.
or no one can hear me.
Singing where no one can hear you. I love that.
Yeah.
I love that. Anything in particular?
I don't know, Lady Gaga,
Oh, yeah, that's fun.
Adele. Try to hit different ranges.
Right? That's the best when nobody when
No one
nobody's
can hear you,
listening.
and nobody can judge
Yeah.
you.
Well,
It's
thank you
great.
for sharing
Yeah.
that, because I like to ask that, because for someone like you that's in demand so much, you know,
Yeah.
you're constantly on the go, and like you said, listening to all these other people with all of their issues, their complaints, their symptoms, and trying to solve these mysteries is the way I would see it. Really,
Yeah.
is like solve the mystery, find the clues, you know,
Yeah.
and follow it.
Yeah.
And I would imagine you have to have something that
Yeah.
keeps you grounded.
And dogs.
And dogs, of
Dogs,
course.
dogs keep me grounded, and
Yeah.
and being by the water and
Yeah.
all those things.
Well,
yeah.
good for you. Yeah,
Yeah.
you have to do that. But
Being outside, yeah. that
yeah,
helps.
and I'm glad that you do that, because that's what helps you be the best caregiver you can
Right.
be.
And you know when you need to get away from it for a
Yeah.
while, you know.
Yeah, it's hard to detach, though.
It
you
is.
know?
It is.
It
You wake
really
up
is.
at 3 a.m. Oh,
Yes.
Did I get that blood test for that? That's what I need to find out. Yeah. That
I
kind
know,
of thing.
that's
It hits
why-
you at 3 a.m.
Yeah,
right?
that's why I keep a notepad next to my bed, because
Right.
3 a.m. is when I wake up and my mind is going already. It's like,
Yeah.
oh, did I email that person? Oh, did I do that? Yeah,
Mhm.
all the things I
Yeah.
forgot to do or can't forget to do.
Right.
Yeah, definitely.
funny.
So,
Yeah.
but that's good. Thank you for sharing that, because I was like, there's got to be something that you do for yourself.
Yeah. And yeah. What else do I like to do? I don't know. Everything.
Yeah.
I enjoy spending time with my kids and my husband, and just being at home is fun. Cooking
Yeah.
here and there, just leveling off and chilling out. You know,
Right,
at home.
right, and just being present.
Being
right?
present.
Yeah.
Yeah.
Definitely. So what would you say to, you know, a woman out there who might be watching or listening today, who like just thinks it's too late, you know, kind of like I'm past the midlife, I'm not feeling good, and it's not going to get better. You know, it's like, this is just what life is like. You know, that's what I feel like, that as we get older, we just expect our bodies to slow down. We expect the libido to go away. We expect, you know, things to get, you know, sore and hurt more and everything. And it's like, I feel like if they could meet you and talk to you, they
Yeah.
would see the other side. You know, they
Yes.
would say like, oh, this isn't like the downhill.
Yeah.
It's like
Right.
you can redirect that, or
You really can.
Yeah.
You may not be able to fix everything, but you can fix some things, and you can make many things a lot better with simple interventions.
yeah,
You know, and it's not too late. It's never too late.
right. And I imagine that you do offer things. I don't know that, you know, if someone wasn't ready for like the full blown thing to get everything, like
Yeah.
do you have like ways that people can just try it out and
Oh, yeah.
understand? Yeah, so it's not like,
Absolutely.
oh, I'm going to
Yeah.
commit to this giant
You don't have to
overhaul.
be all in.
Okay.
Nobody has to be all in.
That's good
you
to know, because
And
people would think that, you know,
Yeah.
like, oh, I'll do it when I'm ready, you know, when I'm
Yeah.
ready to go all in. But
Yeah.
it's like you're saying, you don't have to. You can
you
just
don't.
try some things.
You don't. We can do, there's always smaller interventions. We can dip our toes in. We don't have to jump all the way in.
Perfect.
And, you know, and many of these bioidenticals, they can't hurt you. The worst things of a bioidentical are nuisance symptoms, like nuisance side effects. Like,
Okay.
yeah, I got that that hair on my chin's growing a little
Oh, right,
faster,
right.
or
Yeah. From the hormones, yeah.
you know, things like that. I mean, there's
Yeah,
nothing
that's a
that's
nuisance, but it's-
devastating.
right.
Yeah, nothing can hurt you.
Right.
You
It's
know.
not like the symptoms I hear listed on the TV commercials when it's
Yeah,
like,
but
oh,
no,
these are the
nobody
side
died of
effects, and it's like,
bioidentical hormones.
Oh my God.
I know.
Yeah.
And what blows my mind is who goes to the doctor and asks for this drug after all this stuff
After
that
the
can
listing
happen?
all of those things that
Yeah.
are can be pretty horrific. So,
Yeah,
but thank you for mentioning that, because yeah, I just feel like, you know, if someone might just want to like try it and see, and maybe they feel a little better, maybe they feel a lot better,
Yeah.
then they can go further if
Yeah.
they want to.
Yeah, there's
Yeah.
many interventions we can do to help you feel better and to alleviate some whatever's going on.
Right.
Yeah.
That's great.
Yeah.
So tell everybody how to find you, where you're located, and
I'm located
Okay.
at 300 Main Street in Wenham, kind of across the street from the Post restaurant that used to be the Black Cow.
Oh,
There's
yes,
like a
I
little
know right where
plaza
that
in
is.
there,
Yep.
an older one.
Yep.
Yeah, and I'm in one of the little, I have my little shingle outside of my window.
Okay.
And it's
Your
an
website.
adorable space, and
Yeah.
it's www.coveaesthetics.com. And the phone number is 978-239-0222. And what else can I say?
Great. I think that's
about
it.
that?
You got
Yeah.
it. Are you on social media? Do you do
I'm on
any-
social
Yeah.
media as well,
So they can find you.
Facebook and Instagram. I haven't have not delved into
LinkedIn?
No, I'm on LinkedIn. I'm
Oh.
delved into
TikTok?
TikTok.
TikTok, yeah.
Yeah, I haven't done that yet.
Yeah, I can. Neither have I. Yeah, I get it.
It's too much. to
Maybe
me.
someday, but
Yeah.
not today. Right.
Not today.
So,
Maybe
well,
not tomorrow. either.
This was so good to have you on
Oh,
the show
thank you. It
today,
was so
Jennifer.
fun.
Oh my
Yeah.
gosh. I think, like I said, that I just appreciated how much you shared that is just different information that we don't get
Yeah.
anywhere else. And I really appreciate that, because I think somebody needed to hear it and
Yeah,
see it, you know,
women
hear you say
need to
that.
hear it. Men need to hear it because
Yeah.
you know men suffer from all this too. You know they're having symptoms that can be easily reversed,
Right.
and corrected. That it takes effort. You know, you can't just slip a pill and expect everything to go away. It does take effort and it takes time.
Yeah,
Most of
absolutely.
these things,
Well,
yeah.
thank you. Thank you so
welcome.
much for sharing your
And thanks
time
for
here
having
today.
me. It was great.
Great. And thank you, all of you, for watching or listening here today on Rise, Heal, and Grow with Leah M. Hill. Don't forget to like, share, comment, and subscribe on whatever platform you're joining us on today. And if you'd like to be a guest and you're in the North Shore, Northeast sort of Massachusetts area, Southern New Hampshire, Southern Maine as well, just go to our website, which is apollosunrise.com/podcast, and fill out the online form. Thanks so much for watching, and watch again soon because we have lots more episodes coming up.